So today we will study about the SOFA score, which is used in the patient who are admitted in the ICU. This stands for the Sequential Organ Failure Assessment. As the name suggests, it tells us about the organ functions. Which organs? The 6 organs, basically the respiratory, that is the lungs, the platelet, liver, cardiovascular system, central nervous system, and the renal functions. In central nervous systems, we must know about the Glasgow Coma score, and in this cardiovascular system, we should know about the mean arterial pressure and whether the patient is on the vasopressors or not. So here basically the 6 organ systems are present, and in each system we score them between the 0 to 4. For example, in respiratory system we have to see the partial pressure of the arterial oxygens and the fraction of the inspired oxygens. If the partial pressure of the arterial oxygen is 100%, and suppose if the fraction of the inspired oxygens is 21%, then we divide them both and we will get our value which comes greater than 400. If it is greater than 400, we will give the score 0. Why we take? Because the normal tidal volume is in adult is greater than 400 ml. If it is greater than 400 ml, it means the lungs of the patients are working normally and there is no lung issue. Next is the platelet. If platelets are greater than 1,50,000, we will give 0. If it is less than 150, we will give score 1. If it is less than 100, we will give 2. So any score in any system, if it is greater than 2, it means the organ dysfunctions is present. For example, if in the respiratory system the score comes greater than 2, it means the lungs of the patients are compromised. या तो पेशेंट को COPD हो सकता है, पल्मोनरी एडिमा हो सकता है, या तो उसका प्लूरल जो है प्लूरल फ्लूइड है लंग्स में. इट मीन्स सम intervention needs to be done, or either we have to support the patients with the oxygens. Next, in the liver, the bilirubin level, if it is greater than 1.2, we will give 0, 1.2 to 1.9, we will give 1. So SOFA score mein we have to know the normal values, only then we can assess the functions. As we already discussed that lower the score, more good the prognosis. Maximum score, more interventions required, and patient comes toward the poor prognosis. In this chart here we have, firstly in this part we have to